Have you ever wondered how a small clot in your leg can trigger a life-threatening situation in your lungs? This is the startling reality of a condition known as pulmonary embolism, or PE for short. Imagine our arteries as intricate highways designed to facilitate the smooth flow of blood throughout our bodies. When a roadblock appears in the form of a blood clot, the journey of blood cells gets disrupted. In the case of pulmonary embolism, this roadblock or blockage occurs in an artery in the lung. Most commonly, this blockage is the result of a blood clot that has traveled from the leg to the lung, like a hitchhiker on a dangerous journey. Now, what happens when such a blockage occurs in our lungs? Our bodies are quick to signal that something is amiss. Common symptoms include shortness of breath, chest pain, and lightheadedness. Imagine running a marathon and suddenly feeling like you can't draw in enough air, or picture a piercing pain in your chest that worsens with each breath you take, coupled with a dizzy spell that makes you feel like you're on a never-ending roller coaster. These symptoms are the body's distress signals, indicating that the lungs are struggling to function as they should. We must note, however, that the severity and range of these symptoms can vary greatly. They depend on factors such as the size of the clot and its specific location within the lung. Therefore, the symptoms of pulmonary embolism can range from subtle to severe, making it a condition that can be easy to overlook but crucial to recognize. So it's clear that pulmonary embolism is a serious condition that requires immediate attention. In the following scenes, we'll delve deeper into the silent threat of pulmonary embolism, its causes and risk factors, how it's diagnosed, treatment options, and how it can be prevented. Stay tuned as we journey through the intricate world of our bodies, understanding the threats we face and how we can combat them. Did you know that in the US, an estimated 900,000 people are affected by PE? That's right. Pulmonary embolism, or PE, is a silent threat that is more prevalent than you might imagine. It's a serious condition that can even be life-threatening, but its symptoms can be as subtle as they are varied. You see, the symptoms of PE are largely determined by the size and location of the blockage in the lung's artery. A small blockage might only cause mild discomfort or even go unnoticed. On the other hand, a large blockage can lead to severe symptoms and require immediate medical attention. Common symptoms include shortness of breath and chest pain, which can easily be mistaken for less serious conditions like heartburn or anxiety. Other symptoms like a rapid heart rate, cough, low blood pressure, and lightheadedness might also occur. But remember, these symptoms can be elusive and inconsistent, making PE a silent threat that's easy to overlook. It's also worth noting that PE doesn't discriminate. While it's most common in people over 60, it can occur at any age. This means everyone, from teenagers to senior citizens, is susceptible. It's not just a concern for the elderly or those with certain health conditions. PE is a silent threat that lurks in the shadows, ready to strike when least expected. And here's the kicker. The symptoms of PE can vary so much and can be so subtle that many people don't even realize they're at risk until it's too late. This makes PE a silent but serious threat to our health. So, it's important to be aware, to understand these symptoms, and most importantly, to seek immediate medical help if you suspect you or someone else might be experiencing a pulmonary embolism. This silent threat doesn't discriminate. It can happen to anyone at any age. Let's keep the conversation going and delve into the causes and risk factors of pulmonary embolism in our next segment. Stay tuned. What exactly triggers this life-threatening condition? It's a question that puzzles many, but the answer lies mainly in a condition called deep vein thrombosis, or DVT. This is when a blood clot forms in a vein deep in your body, most commonly your leg. This clot can break free and travel via your bloodstream to your lungs, causing a blockage known as a pulmonary embolism. But it's not just blood clots that can cause this blockage. Other substances, such as fat from the marrow of a broken bone or even an air bubble, can lead to a pulmonary embolism. It's a startling thought, isn't it? That something as simple as an air bubble could trigger such a serious medical condition. Now, let's talk about risk factors. Certain health conditions can increase your chances of developing a pulmonary embolism. These include heart disease, certain types of cancer, and conditions that affect clotting, such as factor V Leiden. But it's not just medical conditions that play a role. Your lifestyle habits can also raise your risk. A sedentary lifestyle, for instance, can lead to DVT and subsequently a pulmonary embolism. This is because when you're inactive, your blood doesn't circulate as well, making it easier for clots to form. Other lifestyle-related risk factors include smoking, which damages your blood vessels and makes clot formation more likely, and obesity, which puts pressure on the veins in your pelvis and legs, increasing the chances of DVT. Even long-distance travel can be a risk factor. Sitting for long periods, such as when you're on a flight or car journey, can cause blood to pool in your legs and increase your risk of clots. Awareness of these risk factors can be a significant step towards prevention. By understanding what can trigger a pulmonary embolism, you can take steps to reduce your risk and protect your health. How do doctors determine if someone is suffering from pulmonary embolism? Well, it's a multi-step process that combines clinical acumen, technology, and a careful review of a patient's medical history. The first step in diagnosing pulmonary embolism, often known as PE, is a physical examination. Doctors check for signs of deep vein thrombosis, DVT, the most common cause of PE. This might include swelling, tenderness, or discoloration in the leg. However, as PE symptoms can be quite varied and may mimic other conditions, a physical examination alone is not enough. The patient's medical history plays a crucial role in the diagnostic process. The doctor will look for factors that might increase the risk of PE, such as recent surgery, prolonged immobility, or a history of clotting disorders. Next, blood tests are conducted. One of the most common is the D-dimer test, which measures a substance that's released when a clot breaks up. High levels of D-dimer in the blood could indicate the presence of a clot. However, this test isn't definitive. Other conditions can also cause elevated D-dimer levels. That's where imaging scans come in. The most commonly used is the CT pulmonary angiogram, which provides detailed images of the lungs' blood vessels. This scan can help locate and visualize a clot if one is present. Lastly, the location and severity of the clot are key factors in classifying PE. A small clot located in a distal or peripheral artery may be classified as a less severe case of PE. On the other hand, a large clot blocking a main pulmonary artery can be life-threatening and is considered a severe case. The diagnostic process may seem complex, but it's crucial in determining the best course of treatment. Remember, early diagnosis can significantly reduce the risk of complications and improve chances of recovery. Imagine you or your loved one has been diagnosed with PE. What happens next? The road to recovery begins with the right treatment plan, tailored to the patient's unique needs and circumstances. The primary goal of treating pulmonary embolism, or PE, is twofold: to prevent the growth of the existing clot and to stop the formation of new ones. This is crucial in ensuring that the blood flow to the lungs is restored and the risk of potential complications is minimized. The first line of defense against PE is often medication. Anticoagulants, commonly known as blood thinners, play a vital role in this process. They work by reducing the blood's ability to clot, thereby preventing the existing clot from growing larger. These medications do not dissolve the clot, but they give the body a chance to naturally break down and absorb the clot. In severe cases, or when blood thinners are not effective, more aggressive treatment methods may be required. These might include clot-dissolving medications, also known as thrombolytics. These drugs are administered intravenously and work by rapidly breaking down the clot. However, they carry a higher risk of causing severe bleeding and are therefore reserved for life-threatening situations. Sometimes, surgery or minimally invasive procedures may be necessary. One such procedure is a catheter-directed thrombolysis, where a long, thin tube is threaded through the blood vessels to deliver clot-dissolving medication directly to the site of the clot. Alternatively, a vena cava filter could be inserted into the large vein carrying blood from the lower body to the heart, to catch any clots that might break off and travel towards the lungs. Regardless of the treatment method, the journey doesn't end once the clot has been managed. Continuous monitoring is essential to ensure that the treatment is working and to adjust the plan if necessary. Remember, treatment is only one half of the battle. The other half is prevention. Regular checkups, medication as prescribed, and healthy lifestyle changes are key to keeping PE at bay and reducing the risk of recurrence. After all, the best fight against pulmonary embolism is one that stops it from happening in the first place. Can we do anything to prevent this perilous condition, you may ask? The answer is a resounding yes. While pulmonary embolism, or PE, can strike unexpectedly, certain lifestyle habits can significantly reduce the risk. Firstly, regular movement is crucial. If your work requires long periods of sitting, make it a habit to take short breaks for stretching and walking. This helps in keeping your blood circulation flowing smoothly, reducing the chance of clot formation. For those with a sedentary lifestyle, incorporating mild to moderate exercises such as brisk walking, swimming or cycling can work wonders. Secondly, a healthy diet plays a vital role. Opt for foods that are low in saturated fats and high in fiber. Limiting salt intake can also help in preventing high blood pressure, a known risk factor for PE. Include plenty of fruits, vegetables, lean proteins and whole grains in your diet. Furthermore, staying hydrated is essential. Dehydration thickens your blood and makes it more prone to clotting, so make sure to drink plenty of fluids, especially water. Avoiding prolonged periods of inactivity, particularly during long trips, is another preventive measure. If you're on a long flight or car ride, try to move around every hour or so. Flex your ankles, lift your knees, and walk up and down the aisle if possible. Compression stockings can also be beneficial for people at high risk. And of course, if you're a smoker, quitting smoking is a must. Smoking damages your blood vessels and increases your risk of blood clots. Lastly, if you're at high risk for PE, your healthcare provider might suggest medications or therapies to prevent blood clots. It's crucial to discuss this with your healthcare provider and follow their advice diligently. Remember, these are not just preventive measures for pulmonary embolism, but also steps towards a healthier and more active lifestyle. Prevention is always better than cure, especially when dealing with conditions as serious as pulmonary embolism. Surviving PE is a victory, but what does life look like after the diagnosis? After a brush with pulmonary embolism, it's natural to wonder about the road to recovery and what the future holds. Surviving PE is a significant milestone, yes, yet it's just the beginning of a journey towards health and wellness. The recovery process is twofold, involving both physical and psychological healing. Physically, the body needs to dissolve the existing clot and prevent the formation of new ones. This process is usually aided by medications and, in some cases, surgical interventions. However, the psychological recovery can be equally challenging. It's not uncommon to experience fear, anxiety, or depression following a PE diagnosis. It's crucial to acknowledge these feelings, seek help when needed, and remember that it's okay not to be okay. But recovery doesn't stop at healing, it's also about prevention. A crucial aspect of recovery lies in making healthy lifestyle choices. This includes maintaining a balanced diet, engaging in regular physical activity, and avoiding sedentary behavior. Regular hydration and avoiding smoking are also key. While these steps might seem mundane and simple, they are incredibly potent in preventing future PE episodes. Regular follow-ups with your healthcare provider are also a vital part of this recovery and prevention journey. These appointments allow your doctor to monitor your progress, adjust your treatment as needed, and address any concerns you may have. It's important to be open and honest with your healthcare team about your symptoms and any side effects from your medication. Remember, you are not just a patient. You are a survivor, an active participant in your recovery journey. Your actions, your decisions, and your lifestyle play a significant role in preventing a recurrence and improving your quality of life. Recovery is not just about getting better, it's about staying better. And this journey, while it may be challenging, is also a testament to your strength and resilience. So, as you move forward, remember to take care of your health, listen to your body, and never hesitate to seek help when you need it. Your victory over PE is just the beginning. And with the right steps, you can ensure it's a victory that lasts a lifetime. You've now gained some valuable insights into pulmonary embolism. Knowledge is the first step, but action is equally important. If you notice any signs like shortness of breath, chest pain, or lightheadedness, don't brush them off. These could be early indicators of a potentially serious condition like pulmonary embolism. Early detection and intervention are crucial in managing this condition. Diagnostic tools, including imaging scans and blood tests, can help identify the issue, paving the way for effective treatments. We're talking about medications, potential surgery, and lifestyle adjustments that can help manage this condition and prevent further complications. Remember, pulmonary embolism can occur in anyone, regardless of age. In the United States alone, close to 900,000 people are affected by it. That's a significant number, and it underscores the importance of being vigilant about your health. So consider this your call to action. Listen to your body, seek medical attention when needed, don't ignore the signs. If you experience symptoms, seek help immediately. Your life may depend on it.